Welcome, everybody, for JeffSolves MedTech 2025. This is the 10th anniversary of this program, which unto itself deserves a little round of applause. I'm proud to say that this is one of the longest running examples of the promise of Nexus learning at Jefferson. We've been running this program since before the universities combined, and it really is a testament to our students and the type of people we attract here at Jefferson who see the power in working together. I'm here today to introduce two amazing teams of Jefferson students who have dedicated a ton of time to problem discovery and developing the solutions that you're going to be seeing today. JeffSolves really is a one-of-a-kind program. There's nothing else like it because we bring together students from medicine and design disciplines to solve real challenges in healthcare. Our students, the way the program works is they work directly with mentors and end users from Thomas Jefferson University, Jefferson Health, Delve, where we're at today, and beyond. And our focus for this program has always been to give students an opportunity to experience real-world problem solving during this essential formative phase of their career, where the skills they develop will serve them well as future leaders and change makers. The lessons we hope our students walk away with is that true innovation begins with empathy, not to be driven by the newest shiny technology, but by understanding the needs of those we help to serve. So today, just as in previous years, you'll see the efforts of hundreds of hours that our students have dedicated into this work. And you're sure to be just as proud as I am and the rest of the team is with how they have approached these really complicated challenges in front of them. So before we move on, I want to say hello to everybody who's joining us online. This is a hybrid event, so we've got a small but powerful live studio over here where we are, and then we're broadcasting this live as part of the Design Philadelphia Festival, one of my favorite festivals and one of my favorite parts of Philadelphia when we get to celebrate the power of design. So welcome to everybody online. We will be having a Q&A after each presentation. So please, if you have a question online, you can use the Q&A feature on Zoom. Now, next, I just want to take a moment to thank some really important folks who make this program possible. This program would be really impossible without significant collaboration and efforts from the people you see on this slide. I want to give a special thanks to Dr. Aldridge, who's joining us online today, and Dr. Baker, who's here with us in person, to my co-directors of this program and longtime collaborators, Todd Corlett, Eric Schneider, and Becky Flax. Our coordinator, Mary Ellen Daly, who we certainly could not do this program without. To our partners here at Delve, who've been fantastic collaborators and put a lot of time into working with our students, especially Tom Dooley and Pat Brandon. And to the Jefferson Quality and Safety Team, our new collaborators for this year, we partnered with them this year to further anchor our problem discovery in the priority issues that our health system is tackling on a day-to-day basis. And of course, I have to say thank you to our subject matter experts and lived experience experts who put so much time who are always willing to contribute time. I can't name them all. So many of them are unnameable, but our students really couldn't learn what they learn or do what they do without them. And I want to especially say thank you to our Jefferson nurses who, despite being some of the busiest people in the world, always find time to speak to our students and to contribute their energy to these projects. It really is amazing, the types of people we have here at Jefferson. So I just introduce our two teams. We got two teams that'll be presenting for you today. Congratulations to them. You survived a really tough summer intensive period and you made it through to today. Many of them have tests last week or working on new big projects in school. So this is something that they do on top of their curriculum. And I really have to commend this mixture of medical, industrial design, and textile design students who we have working with us. The format for today, each team is going to have 10 minutes to pitch, followed by 5 minutes of audience Q&A. If you want to find out more information about this program this year, see a recording of this event, or see what has been done in previous years, you can find us on the website here on this slide. So I want to just quickly hand it off to Dr. Baker, Provost at Thomas Jefferson University, to say a couple things.
Thank you. I want to welcome everybody. This is on behalf of Dr. Aldridge and myself and the leadership team. This is definitely one of my favorite events because it validates, our value proposition. So, what we're doing here is mixing disciplines in design with medicine, with Delve, which is industry, and come up with solutions that will help people and I think and improve lives. So thank you again for everything you do. And it's a very exciting event for me. So thank you for having me again.
Thank you, Matt. Thanks for being here. And then next up, I just want to give a couple minutes to our hosts here. Today we're at Delve's Philadelphia studio. And I'm going to hand it off to Tom Dooley, who's the Director of Strategic Accounts here at Delve.
Good afternoon, everybody. Thanks for coming today. I think this is our seventh year involved. It's been a wonderful program to be involved with. We've seen a lot of great project work with a lot of great students and faculty. So we're very excited. Big thanks to Pat Brandon and my other colleagues that jumped in to help with prototyping and different presentations. So I'm not going to say a whole lot more than that, but thanks again for letting us be part of the program. We're very excited to see the work, and I'll hand it back to you.
All right. Thank you. Thanks for keeping it brief. I promise we are going to hopefully get through all of our content before the first pitch tonight of the Phillies game. Okay, so the last thing I'll leave you with is something I always tell our students, and that the things that they do are always super impressive, super interesting. I think you're going to see two very unique products that address completely different problems, and you're going to be surprised by how they approach them, right? It's actually one of the challenges in healthcare is you see these wicked problems that are really complicated. And how do you begin to solve them? You solve them with simple solutions. That's where you start, right? But despite that, this is something I always tell our students that it is not the work that they're doing that's the product. They are the product, right? Is these experiences that they're able to have, as challenging as they may be, that is the real value here. Just icing on the cake when they actually come up with something fantastic, which they both have. So without further ado, I'm going to introduce our first team up to the stage who's going to present their concept. And just give me a moment while I move the slides.
Hello, everyone. Meanwhile, I'm just going to introduce our team. My name is Tuyabi. I'm a medical student.
Hi, my name is Jeet. I'm an industrial student. My name is Nicholas Wang. I'm a student at Sidney Kimmel Medical College too.
And I'm Spencer Haber. I'm also a medical student as well.
We also had a team member in textile design who apparently couldn't make it today, but yeah, her name is Kiana.
And thank you, everyone, for joining us today.
Are you ready? We're
Yep.
ready. There you go. All right.
Hi, thank you, Rob. Hello again. Thank you for joining us. And I'm very excited to introduce Handled, a bedside storage system our team designed to help patients organize and keep track of their personal belongings during their stay in a hospital. It attaches to the bed rail, stays there, and is accessible throughout the entire admission and can even go home with the patients upon discharge. We know how frustrating it is when the essential personal belongings are out of reach or get lost. And that's where Handle comes in. Our slogan is, relax, all your belongings are being handled. So imagine yourself just been admitted to the hospital, and this is your room right after the lunch is served. Earlier today, the nurse gave you a list of patients, of doctors' phone number to call to schedule follow-up. But now you're not sure where you can find it. You need your phone and your calendar, but you just had surgery. It's very difficult for you to get up and going through the drawers, search the cabinets. So now you want to call the nurse, but then you realize you can't find the call bell. So if that feels frustrating to you, you're not alone. Our research shows that patients report losing or misplacing their personal items every day during hospital stay. On top of that, hospitals spend somewhere between $16,000 to $50,000 every year just to reimburse patients for their lost belongings. And in addition to the cost for direct reimbursement, the cost of spending on nurses' time and labor on helping patients to find their personal belongings must be considered as well. Using Jefferson as an example, they spend about $7 million to $9 million each year on the time nurses spend on searching and finding patients' personal item upon request. And this time and labor can be used on other essential tasks, considering how busy the hospitals are every day. So early in our design process, we asked this question: what items are patients most likely to misplace, and how does that affect their experience at a hospital? So after interviewing patients and staff members, we came up with a consistent list: dentures, hearing aids, glasses, phone, call bells, and essential documents. In fact, these items are not just personal items. They're also critical to them. Without dentures or hearing aids, patients can't eat or hear. Without glasses, patients can't see. And without phone, they can't keep in contact with their family members. And during the long hours, staying in the hospital is so boring, and they just couldn't find a way to make themselves better. And imagine if you can't find your call bell, which is another very common issue, and you're hungry, you're thirsty, you're in pain, and you really need to find something, how frustrating it'll be. So these everyday frustrations or fear of losing essential items became the foundation of our design. So currently, there are 3 main places where patients can keep their personal belongings. First, the bedside drawer. It's stable, but it's often very hard to reach, especially for patients with limited mobility. It can even increase risk of fall for senior patients because of its awkward angle to reach. And second, we have the overbed table, which is very popular. It's within the reach, and also it has a lot of space, but it's often cluttered. And we heard a lot from the patients that sometimes their personal items, if it's like a small item, can be lost with the food tray when they clean the table. And nurses also report that cleaning the clutter or finding items from the clutter often slow down their daily task. And lastly, some of the rooms have sofas, but these sofas are not always available. It's not in every room. And often these spaces are for non-essential items like clothes or shoes, and it's not really accessible. Patients have to get up or ask a nurse to get what they want. So it's really not ideal for patients with mobility issue. And there are another commonly used item in the hospital, which is the personal belonging bags. Every patient can receive one, and it travels with the patient throughout their stay. But in reality, it's not consistently used. And there's no documentation of what's inside. There's no dividers or organization, and items are hard to locate. And you often see patients have to dig through everything just to locate one single item. And that really adds to the stress and delays. So after interviewing patients and staff members, we identified 2 main problems. 1, patients have trouble seeing where their items are. And 2, they often can't reach their belongings right away. These issues come down to 2 keywords: visibility and accessibility. So this further leads to our how might we statements. How might we enhance the visibility, accessibility, and organization of patients' belongings in order to support patients' autonomy, minimize item loss, and reduce clinical staff burden during hospitalization? So, with that important question in mind, I want to walk you through our ideation process. Our first concept was a redesigned bedside table. It could be adjusted up and down, even moved like between rooms. However, very soon we realized that it was not fully accessible because patients with limited mobility, they're going to have a hard time lifting it or adjusting it. And the compartment couldn't be opened unless the table was folded down. So then we move on to something that can be attached to the bed rail. So we have this personal belonging holder inspired by a laundry hamper. While it keeps things close to patients, however, patients still need to get over to reach their items, which will create more challenges than solution. So finally, we had this idea of a bedside rail caddy, and it's flat against the bed rail, and it includes organized pockets, and that makes personal items visible, accessible, and also within the reach. So now we want to officially introduce our product, Handled.
At first glance, it looks like a suitcase, right? A hand briefcase. But no, it's much more than that. So, a seamless, minimal approach for creating handled. It has divided compartments for organization, a good, very ergonomic design, very simple, minimal, where it clearly identifies where the patient belongings should be stayed and how it should be transported while room transfers. According to our surveys, well, we also found one big loophole where many personal belongings of the patients were misplaced during the room transfers and while they got discharged. So now you have your personal belongings right beside you. Talking more about the design, focusing on accessibility and visibility, each pocket is tailored to hold 6 personal belongings depending on what patients would have. No dedicated space, but yeah, it would definitely hold dentures, phones, hearing aids, glasses, stationaries, and some paperwork, which is definitely required when patient is admitted to it. To make this thing easier, Handle uses clear pockets, front, quick identified, and color-coded trims for visual impact. So this thing cannot be lost anywhere as you can identify this particular blue trim going through all around. Secondly, we focused more design, is creating a checklist and some personal vinyl stickers which would be provided with this particular thing handled while you are admission, like patient's admission. So a checklist would be there where patient would write all their belongings down during the phase of their admission, which would be all the time inside the handle. So while room transfer and while discharging patient belongings, they'll be listed. Nurses would have a look at that, and family members of the patients would also check that okay, this have been stored, this are there in the pockets and not lost. Patients can take this thing with them to their home if they want to, as this will keep them very systematic and oriented. Secondly, increased anatomy and fewer staff interruption. That was the main target which we focused while designing this. Handle empowers patients to independently access the patient items, while for staff, very clearly labeled visible pockets would give clear indication that okay, this particular item is missing from this pocket, so they don't waste their time for searching around. Lastly, we created a very short storyboard how this entire thing would look like while processing. So during the patient's admission, patient would be given the handled backpack and a label with stickers on. Then it's up to patient where and how they want to keep their stuff. No dedicated space. It's all open, all clear, very accessible. This is clear comparison as you can see, Handle directly addresses the key challenges posed by traditional patient belongings bag, offering greater visibility, accessibility, organization for both patients and staff. Financial impact, sorry. Yeah. So Handled is priced much more than a normal ordinary patient belonging bags, but we pose this very upfront that costing is a secondary criteria, where if we are comparing overall costing from while handle cost more upfront, the hidden cost of the current system are so far greater. While you factor in staff hours spending searching for lost items, cost for lost belongings, and reimbursement claims, hospitals are spending between 7 to 9 millions annually. So why handle is important? For hospitals, it leads better overall patient experience. For nurses and staff, handle means more productivity, time spent on important clinical tasks rather than just looking around for patients' belonging. And lastly, for patients, restore a sense of autonomy. Thank you so much, team, for making this project possible. And yes, stage is open for questions.
All right, we're going to take questions. I'm just going to stop the share so everybody online can just see your faces. All right, who's got questions in the room? That's right. It's my job to run the mic. I forgot.
That's a nice product. I'm just wondering about the cleanliness. How do you clean the product? The plastic bag you can wipe clean. How about your
That's an excellent question that we take into consideration. We're trying to figure out how to keep hygiene a big part of our model here. And our product here is actually designed to go with the patient, with them. So cleanliness may be tedious for it, but we're not trying to turn it over between every patient as certain room items would be. This is something that's designed to be with the patient, which then require less cleaning between shifts there, and something that they take with them between all their different transfers in different areas. So we intentionally designed it to need to have less cleaning by being a personal belonging that stays with the patient.
And we got a question online, which is a very intriguing. I'm curious how you guys are going to answer this one. Amazing job. Was theft prevention a consideration in the design process? Security. Who wants to answer that?
Definitely, theft was one of the reason why we have made this opaque inside out. So patients can look at the pockets as pockets are transparent, but the entire thing is not transparent. So this is going to be on the bedside rail all the time. It doesn't have any lids on it because then it will restrict the patient's accessibility. But just to keep a opaque layer from people in the hospital to the patient, so you can't see directly what patient items are unless and until you are very closer to the product. So that was the sense of keeping a opaque layer inside.
Anyone else here? Lynn, you don't got a question for me? I'm staring at you. Oh, really? All right, we got one back here then. If you think of another one, let me know.
Is the intent for it to be disposable?
So is it disposable versus the random sack that we currently use?
I would say it is reusable than disposable, as it is going back home with the patient. Now it's up to the patient how long they want to use it. And of course, it's going to create a sense of organization for them through their routine life. So yeah, I would say it is not exactly disposable, but it is reusable.
Follow up with two patients. Are patients actively perfectly back to 100% health when they leave the hospital? Right.
Oh, yeah, that's why we consider that. Yeah. So the comment from Rob is patients completely healed or healthy when they come home. So we did that research. That's why we designed this. This is part of the post hospitalization care. So a lot of patients still need to take medication and follow certain care routine. That is why it's important for them to have a continuation of the care. And some patients even have stretchers at home, and they prefer to sleep on that. And this will make their organization of post-care much easier.
Last call.
Yeah.
All right, fine. Here we go.
What material is it made of and where it is made?
In terms of material, the entire thing is made out of fabric, and the pockets are made of polypropylene, which are being heat treated to create the pockets little bit sturdy pockets, not flimsy enough to just sag it down. But yeah, those are the combination of fabrics and plastics which are currently used in medical industry, which are not hazardous to the patients.
Where's Nate?
Yeah, that's not really yet, but yeah, it would be a mass production thing. So, yep, it would be using industries for making that. Definitely, we have a very crude prototype I can show you.
All right, and while you're showing the prototype to the room, I'm going to start transitioning over to the next team. So give me another round of applause. The team handled. And one of the fun things for everybody who's here in person is you get to handle and literally handle the handled. You get to handle the prototypes that they have spent a lot of time creating. No. What have I done? Thanks, Rob. You take that. Good. Good to go.
All right, thank you so much. So thank you all for being here and joining us online. We are AuraVena, warming the way to better IV access. Before we get started, just to introduce our team, my name is Isaac Kravatz, and myself, along with Bassem, are medical students, and Isaac Pellegrino and Anastasia are students of industrial design. So to get started, we want to introduce you to Sarah. So Sarah gets regular monoclonal antibody treatments for her Crohn's disease. This is not something she looks forward to because every time she goes in for a treatment, she's required to get a peripheral IV. So she's getting stuck multiple times by a healthcare professional. And when they even place it successfully, it is not a comfortable experience. Sure. So Sarah's experience is not unique. There are millions of patients annually who are getting monoclonal infusions or other infusion therapies. Good. Okay. And this means that every time they go in for an infusion, they're putting in an IV, which oftentimes does not happen on the first attempt. Definitely. So as a matter of fact, we actually found that 40% of peripheral IVs when they are placed fail on the first attempt. And at Jefferson, the policy is that after 3 failed attempts, patients must go home, reschedule their appointment, which is oftentimes tedious and really disruptive to their routines. And so in addition to that, being stuck multiple times or having multiple attempts for IV insertion causes pain, bruising, or blown veins. This is something that I'm sure a lot of us can relate to. And it causes a feeling of being anxious. And these complications definitely disrupt routines and drain a lot of energy. Additionally, the stress and discomfort causes a lack of autonomy, and this inconsistent experience is not something patients want to endure. Additionally, they're wasting a lot of time when they're having nurses try to place these IVs multiple times, and we'll talk about the cost in a second. So on the first attempt, if it's successful, it's a very inexpensive procedure, which is important because a lot of IVs are placed. However, every successive attempt is exponentially more expensive. And this is due to a number of factors, including the opportunity cost of treating other patients, as well as the need for additional staff who are higher trained or additional equipment. And so peripheral IVs serve as a critical access point for patients, as there are nearly 200 million IVs placed each year, yet 40% of them fail. And so this is where we born our idea. And so something that we heard from healthcare professionals in this field is that when peripheral IVs are difficult to place, they resort to a heating source. And so what you're seeing in this image is an infant heel warmer, which is a very small heat pack that is used to warm up a patient's arm before an IV is placed. So let's talk a little bit about why heat works. So in a quasi-experimental study in Japan, researchers found that when heat is applied, veins are dilated to a greater diameter, which improves the ability to place an IV. Your veins become more visible and the vein depth is reduced, bringing them closer to the surface, which makes it easier to see. And being able to feel veins was improved overall. These factors contributing to a successful IV placement. And so in a different study that we read, we found that when patients are exposed to a consistent heat source for about 5 minutes at the range of 38 to 42 degrees Celsius, the factors that I just spoke about are improved significantly, which makes it easier to place peripheral IVs. So I showed you a little bit about the heat pack that is used in the hospitals right now, but other things that are currently being used are hot towels, which are also an inconsistent source of heat. They're single use because they have to be laundered between each patient, which, while an inexpensive source, is ineffective for the most part. On the opposite end of the spectrum, we have IV finers and ultrasound, which, while they are expensive and maybe not the most reliable because they are time consuming, they also don't make it easier to place an IV like heat does. They just make your veins more visible. So that's where we born our invention.
Thank you, Isaac. So after we've done all that research and we identified a problem area to design for, we needed to set ourselves some parameters. So we asked ourselves, what are the most common sites for IV insertions? So we found that around 90% of IVs take place between just above the elbow and about halfway down the hand. So from here, we decided to design around this area of the arm. We began by looking at a product that could possibly be attached to an infusion center chair. This would be nice because it would always remain in the same place and there would be no need for extra storage. However, this presented a couple issues. It would need to fit all chair sizes, which varied from place to place. Additionally, it might be more difficult to clean if it was in a fixed location, and also it would need to work for both the left and the right arm. So next, we looked at the possibility of making a product that would sort of walk the healthcare professional and the patient through the whole IV process. This was nice because it would help apply pressure and reduce vein blows. However, we decided that this might be difficult to wire and figure out the internal components. Additionally, a product that was working and heating in this way might be cumbersome to replace the battery. Additionally, it would be difficult to make it a one-size-fits-all product. Next, we looked at a device that could possibly be used before the IV insertion. This provided a lot more pros. It didn't disrupt the already established workflow of inserting an IV. It allowed it to work for both the left and the right arm, and it provided better overall coverage. So this is the idea we decided to further look into and move forward with. From here, we just started to develop some prototypes. So on the left here, you see prototype number 1. This one used a Velcro system along with an attached tourniquet. After receiving some feedback, we decided that the Velcro system wouldn't be the best because it would degrade over time and it would also make the device harder to sanitize, which isn't great for a medical environment. Additionally, we received the feedback that the attached tourniquet wasn't a great idea because applying a tourniquet is already a really widely practiced thing when giving IV insertions. So next, we made another prototype that used a weighted panel security system to wrap around the patient's arm. We received the feedback that this worked much better, it was much more intuitive, and it was more of a one-size-fits-all option. From here, we developed a higher fidelity prototype and some renders that included an interface with a red and a green LED light to indicate to the healthcare professional when the device was being heated and when it was done. Additionally, on the inside, there were arm sizing reference points, and on those weighted panels, they were labeled 1 and 2 to help the healthcare professional know which one to place over the arm first and second. We actually took this to a focus group with some nurses from the infusion center at Jefferson, and we received some great feedback. The first thing that they said was that flap label number 1 should be a lot thinner and longer compared to the flap label number 2. This would make it a lot easier to secure on the patient's arm. Additionally, they asked us to introduce some hospital-friendly colors, as in its current state, it's just dark gray and black. Also, the size of the LEDs should be a little bit bigger because right now they're pretty small and would be difficult to see in a busy workday. So that brings us to introducing our product, AuraVena, a reusable heating sleeve for infusion centers that improves IV success rate by enhancing vein visibility and easing patient anxiety. And there it is in action. And it's right there too. So how do you use AuraVena? Well, you'd start by unwrapping the product and placing it under the patient's arm. You would then have them line up their arm based on their arm size using the reference points. Then you would take that panel labeled 1, wrap it around the arm, and then the other one labeled 2 and wrap it around the other way. You will immediately see a red light illuminate and the heating sign come on, indicating that the device is on and it's working. After the appropriate 5 minutes have passed, the green light will turn on and begin blinking, indicating to the healthcare professional and the patient that the device has done its job. From here, you can unwrap the AuraVena and insert your IV on the very first try. When you're done with this and you're ready to reuse it, you simply wipe it down with the sanitizer wipe, roll it up along that long weight labeled number 1, and use the securement tab and the securement hook to keep it wrapped up. When you're done with the AuraVena for the day, you simply plug it in using a USB-C charger, which is something that we found was already really common practice in these infusion centers. Going into some of the specifications and features of AuraVena. So on the outside of it, there is printed just the basic steps of use to further reiterate to the user how to go about using the product. Additionally, as I mentioned, there are those arm size placement guides and those labeled 1 and 2 weighted flaps. Additionally, there is the interface that also is the housing to hold the internal components. Going a little bit more into the interface, you would start by hitting the power button, and then the heating light will turn on, and then the done will turn on, giving that little chime, which you may have heard on my computer, even though it was really quiet. So this is sort of how the interface will work and interact with the user. Additionally, on the bottom right-hand side of it is a battery indicator light, where it just shows the user how much battery is left in case they need to plug it in. Looking into the materials of AuraVena. So the main fabric would be a polyurethane coated nylon, which is the exact same fabric that is used in blood pressure cuffs, and that's what allows this to be so easily wiped down and sanitized. The device would be heated using a conductive wire in the middle, which is very similar to how a lot of heating blankets on the market work. This would be regulated using a closed loop sensor system to make sure the device stays at the 42 degrees Celsius it needs to be and it doesn't harm the patient. Additionally, the long weight labeled 1 would be weighted using sand, and then the other side would be weighted using the natural weight of the battery and the internal components, which include the LED lights and the LED strip, and many others. All right, and now back to Isaac.
Thank you. So the ultimate goal of AuraVena is to overcome difficult IV access. We want to reduce the number of attempts for patients, reduce their discomfort and anxiety when they're going in for their infusion treatments, and integrate something seamlessly into the workflow that is currently in practice when placing an IV. Also, we'd like to reduce the unnecessary costs that occurred both the patient and the healthcare system. So a little breakdown of what we think the manufacturing costs would be. We estimate that AuraVena would cost anywhere between $24 to $40, but also understand that if there's a need for this device to be regulated, it would have an additional cost with it as well. And then target retail price anywhere from $59 to $79. But I think more importantly is the potential cost savings that we've calculated using a per 1,000 patient model that just highlights that if we were able to reduce the 40% of failed first attempts by 30%, we could save the healthcare system anywhere from $20,000 to $70,000 annually or per 1,000 patients if AuraVena is in place. Taking a step back just to look a little bit about the market size, the global infusion therapy market is quite vast. There are over 3,600 outpatient infusion centers, and there is a booming wellness IV fluid and hydration market that would be a definite growth driver for us. And lastly, our next steps are to develop a functional prototype and develop and test the interface that Isaac spoke about. We'd also like to conduct an efficacy study with our functional prototype using ultrasound to measure the metrics that we talked about previously. And if needed, eventually a regulatory assessment. We thank you so much for your time, and we'd love to take your questions.
All right. Just stop the share and open up the floor for questions. Sure.
Hi, my question is about the temperature range. Is there a maximum temperature? Can you adjust the temperature? Just a maximum temperature to prevent any kind of burns, and maybe if you wanted it a little bit lower for elderly patients that have thinner skin. And I had one other question was, how long did it take? You may have mentioned that, but I missed it.
To take that. So this thing differentiates from a lot of the heating blankets on the market because we are actually the ones telling you how hot it needs to be based off of the research that we did. So the device will stay at 42 degrees Celsius from the point that it is heating to after the 5 minutes it takes. That's just the time and the temperature that we got from our literature and our research for the best vein dilation possible. This temperature really isn't that hot. It's something that should burn you to the touch. And then in the system itself, it's a closed loop system with sensors on it. So if it senses that it begins to kind of creep above that desired temperature, it will, oh, there I am. It'll make sure that it doesn't go above that. So it should ideally stay at that 42 degrees the entire time.
All right, we got a couple questions online. First one is there a warning signal if it malfunctions or gets too hot? I know you kind of just answers that, but like, you want to just elaborate, like what, do you think you'd have to build a fail-safe into something like this?
I think if we did build a fail-safe into this, which is definitely a step moving forward and a great idea, I think that that should just be the device turning off and no longer heating up if it senses that it has gone above a temperature that is then dangerous for the patient.
All right, I'm going to go back to the internet. Great product and awesome presentation. Wondering what size range you designed for. Would a small fit a child, or would that require another version?
So actually on the AuraVena itself, there are multiple indications, whether it's for a small hand, for a medium size hand, or for a large.
Any reason it wouldn't fit a kid?
I don't think it shouldn't fit a kid just because of the indicators. And I just feel as though if you're just wrapping the arm up, you just can wrap it a little bit more snug.
All right, we got one more online and they'll go back to the room. Stellar presentation. You are addressing a very important and common challenge. Can you go into more detail about how you're calculating cost savings? All right, someone wants to check your math. Go for it.
I would love to tell you about that. So we took the cost that we determined from reading a lot of articles that the additional successive attempts cost anywhere from $178 to $540. So we took that range and multiplied it by 1,000 patients, just given the breadth that we think this product could reach. And we determined if we maybe could reduce the 40% of failed attempts, so let's call that 400 patients, if we could reduce that by a third, so that'd be 120 patients that would not need successive attempts where that cost of $178 to $540 would not be reached. So I know that's really convoluted math, but those are the numbers we use to try to get to a point of determining, if we could reduce by about 30%, which we thought was a pretty conservative estimate for what we think this product could do.
Yeah, go ahead. Also, a good number of our calculations are from one of the studies that we have referenced in the paper. So one of the studies, it was a study investigating the cost pretty much of IV placement as well as failed attempts. And so we took their amount of money for our calculations and made some estimates based on that.
Excellent. All right, returning back to the room. Any questions here? All right, I'm going to start over here, then I'll head back there.
Great concept. My question is to put it to the market, what type of testing needed and how much cost involved?
Yeah, so what do you think? What kind of testing are you going to need to validate this thing?
So I think first of all, I think with our prototype,
we have to apply for an IP through Jefferson and then test it in our infusion center there, and then see how effective that is, and probably reiterate. And then it's a couple steps before it goes into the market. That's what I'm trying to say. And so the amount specifically to go into market, we don't know off the back of our head. But our next steps are to create a functional prototype and to take that to the infusion center at Jefferson.
Okay, I'm gonna go back here.
I have another math question. Have you done the math for how many cycles you get out of that battery charge, and then how long you think it's going to take to recharge it between uses? And I'll add a second. Are there other fabrics, like reflective fabrics, that you can use to improve some of the efficiency of that? Have you looked into that as well?
Who's gonna take them?
So the issue with the battery, that is something we did calculate. The specific battery that we chose was a battery that was large enough and had enough capacity where this thing, if it was charged overnight when the infusion center is closed, at the same time when a lot of these other devices would be charging, it should have plenty of charge to last the entire next day. I believe the battery charge after our calculations should last you around 4 to 5 hours after full charge, especially if this device is only being used 5 minutes at a time per patient. That should last the entire workday. To answer your question about if we've explored other fabrics to help enhance the heating, that's something we did look at. However, we decided that making sure that this thing was an exact temperature was more important than having the fabric work with the conductive properties, because that would be much more difficult to measure an exact temperature for that. Rather, that would be more of a range. Thank you.
I got one back here.
Thanks. Nice work. So y'all brought up the wellness and voluntary infusion market at the end as a big opportunity for growth. I'm wondering if you could speak a little bit about what's the same, but also what's different about that environment, and how that might affect your design.
Thank you for that question. So the process of placing an IV is the same no matter where you're doing it. I think when we talk about the wellness industry, this is kind of like a luxury add-on that could be used in the services, something that makes a patient feel more comfy and cozy rather than like a necessity for opposed to a patient who has difficult known IV access, which is what we originally designed the product around. I think the major difference there in the practice of the wellness market is just that it's a nice to have option as opposed to a necessity. But I like the thought process.
Something else that was also brought up through talking to infusion center staff, as well as other people who have experience in these other wellness industries, was that the infusion centers already have charts, and they have a log of which patients are difficult sticks. So they would probably pick and choose which patients to use this product on, or the patient would request it ahead of time. And a lot of these other wellness industries, it's more of a premium, it's more of a luxury thing. People are paying for it. So I could see this being much more of a regular practice for every person in those industries, as it would be another reason why someone is paying such a premium to get the service.
Also for the wellness market, so our product mainly is to help dilate veins. And so in any room, whether obviously with patients in the hospital, we know the hospital is cold. It's a cold place. And also you have patients who may not be in the best of health conditions. So that makes vein placement even harder. But also in a wellness center, any cold room will make your veins kind of constrict. So that's just like an extra, like both Isaac said, to like help the person kind of like find that vein easier.
All right, anything else online? Oh, we got two. Okay, yeah, sure.
Considering the battery safety, what protection do you provide for safe, not battery smoking and then overcharging? And also, is there a testing labs where you can get certified
So what are you going to do about the explodey batteries? Should be a quick one.
I guess this kind of goes back to what Isaac was saying earlier. There would just be a shut-off system after a certain temperature. At the moment, we did think about sorry, for the closed loop sensors, so that would indicate that the temperature doesn't go over the 42 degrees Celsius. For testing, I know that Delve actually was offering to do some of that testing. So if we want to get in touch with them after this, we could.
Yes. We don't know where we're going to do that yet, and we would need a lot of money to do it. But yeah, certainly getting this certified would be a requirement if we were going to use it in a healthcare environment. All right, last question.
Thanks. Great presentation, guys. Did you guys make any consideration around storage of the device? I know you mentioned charging, but how many do you envision a hospital setting, for example, having one per room, or would these live in a common cart area? Just, I guess, storage. Basically, did you make another product to keep these things organized?
So for this design, we actually have made it to roll up, which then you can actually place on top of a drawer. Typically, the nurses will have about 4 pods. In each pod, there will be about 4 patients. So you'll only have one of these devices in each pod. It wouldn't be per each patient. And then it could just be rolled up, stuck in a drawer, or it could just lay on top of a counter.
Yeah, so we actually brought that last prototype that you guys saw, the one that didn't roll up, to that infusion center where we spoke to a lot of staff there. And this is where we got a lot of that information about how many chairs are per pod and how many of these they would like per pod or per patient. So they said 1 device per pod, so 1 per 5 patient should be plenty. And in that, we showed them kind of the footprint it would be if it was rolled up or folded up. And they said, that's great. You can just easily throw it in a drawer. And as far as the overnight storage, they do have designated like sections in these pods where they have to already plug in other devices and leave them there overnight. So we'd imagine this would just live with those other devices.
All right, give me one more round of applause for Team AuraVena. Yeah, thank you. All right, well, as you could see, it's always easy to see like where these products end up and say like, oh yeah, obviously that's a great idea to fix that problem. But I just want to like comment on where this started, right? So we were, like I mentioned, we were lucky to partner with Paul, the quality and safety team. And as long as I've been in healthcare, one of the big problems everybody talks about is falls, right? So how do you solve for falls? Well, believe it or not, the end of the many questions of asking why and how and digging into that and talking to people was that, sure, you can make sure there's nothing to trip over. There's like so many things that people have tried, but a lot of times the reason people fall, turns out, is because they're trying to reach for something that's important to them. And then boom, you have this now a seemingly obvious solution that is getting people's belongings close to the bedside. It is really difficult to go from we're trying to avoid falls and getting to that end solution. So I just want to point that out. And for the other team, right, it's same kind of thing. This actually started from a patient satisfaction question, right? If patient satisfaction is so important to every single health system, large or small, doesn't matter. And how do you tie satisfaction to actual like clinical outcomes, and not just satisfaction of patients, but satisfaction of the providers who are working usually at the limits of their capacity, and then identifying, hey, wait a minute, like IV sticks take time. Nobody wants to get stuck more than once. Can we use heat? Like the confluence of ideas that have to come together to get us to what we just saw today is really commendable. So I know it's really hard for our teams to navigate this ambiguity, and then healthcare makes it all the worse. So I want to just commend them for their work, for kind of pushing through this messy process that is product design, and thank everybody here for joining us today to celebrate what they've done and for supporting them. So thank you, everybody. We'll see you next year. Oh, and one more thing before I sign off, 2026 isn't just the 250th anniversary of this country. It is the 10th anniversary of the Health Design Lab, where this program resides. So be on the lookout for something really cool next year because we're going to be back with something even more exciting. So I can't wait. Thank you again.